you. Thank you for those kind words, Joelle. Yes, I'm a family physician in Westminster. We are very blessed in our clinic to have people with expertise in computer science and engineering and whatnot. It seems like I've amassed the A team unknowingly. Um, my disclosures are there in the PowerPoint. You will indeed be able to access that and use that as a reference. My hope for tonight's webinar is actually show you a live demo more than anything else. This is a reprisal of the talk I gave at OscarCon at SFU earlier in the summer. So if you've seen that, I'm sorry. Hopefully I'm covering some new things, but a lot of it will be repeated. So I'm going to shift over and share my screen. Let's see if this works. There we go. I guess we don't need this. I'll start on page 1. So hopefully everyone can see the PowerPoint. Got that in my way. It's a little confusing here. I've got 2 screens. I should be looking this way. So welcome. This is the webinar on how to create your own LFP billing page or billing page in general. I am a family physician. I won't have to tell you much more because we've already repeated it. For this webinar, I'm not going to turn off Grease Monkey. I've become so dependent on it that I think it just needs to be there. Otherwise, I'm in unfamiliar territory. I will point out where Grease Monkey is active and where it's not active, but you can ignore it for the most part, okay? The good thing and the bad thing, it's blessing and a curse about Oscar is how customizable it is. And Grease Monkey actually is a customization of your browser, not so much Oscar itself, which is the bane of the OSP's existence. So they have no control over that. They don't like it because if it goes wrong, they're really not inclined to fix it. So if you use Grease Monkey, you should know that in advance, okay? I am no longer an official board member of Fraser Northwest Division. I have been from day one as its founding board, but I still participate a lot in the Fraser Northwest activities. I recognize a lot of the names of the participants tonight. Some of them are PSP folks, some of them are family physicians and MOA, so welcome everyone. What I hope you can do here is share this information with those who need it. So the goal of this workshop is to create a new billing page. A lot of it is screenshot on the PowerPoint, so I won't go through a lot of it live, but there are some parts that I think you really do need to see. You should be able to customize these fee codes in the billing page, set default billing pages per user if possible. And this is indeed possible for Oscar Well version, and I hope it is for all versions, but I don't know exactly for Juno and Open and Ampere, whether that's possible, and how you can easily switch from one billing page to another as you're billing. I'm not going to show you how to set up various details like the business cost premium, facility codes, that's not part of this, or how you can even get new MSP codes. It's not that difficult, or this has nothing to do with private billing. But I will show you the Grease Monkey elements. And the main reason for doing this is we are generally moving towards this new form of billing where we're not doing fee for service. If you're still doing that, good on you. There must be, very powerful reasons. It may be because you're still doing a niche element of family practice like obstetrics or residential care. But by and large, community care has shifted either to a new to practice salary model or to the LFP model. And to make it easier, I think you really do need to set up a good billing page. The problem is WCB and ICBC are still based on fee-for-service codes for now. It gets pretty complicated and you need to pay attention to those, otherwise they get rejected claims. Here's an example that everyone should know if you have been billing in the fee-for-service world. This was set up for you likely by whoever your OSP is. It's the standard, GP billing page. It's got the age-related office visit codes. It's got a number of codes in the second column that are usually procedural codes and various other things. Some of it's customizable, some of it is not. So this basically describes what I've just shown you. I won't go into that. And for some reason, we all seem to have this anesthesia billing sheet as well. So whoever made this kept this in the default version. don't do anesthesia, so I've never had to look at it. There's an obstetrics one you can create. I created one for long-term care because there's a select number of codes that we use consistently and frequently. So I don't do long-term care now, but at the time, that was helpful. We also have other providers in our office. We have a nurse who bills under a nursing fee code, which is mostly shadow billing. They have a lot of complex codes, and we created one for them. So if you have allied professionals who need to shadow bill, you might as well create a billing code and make life easier for them, a billing page and make it easier for them. We have locums, fortunately, and they can bill under our LFP, slightly different set of codes. You can see there are very few, and they simplified it. It's again, a blessing and a curse. And here is how I created my LFP code. Just to give you a brief overview, I've circled the times there. That's critical for billing your time, start and end time. There's only about a dozen codes that you really need to know. On the left hand, I kept with the visit codes. On the middle column, it's the procedure codes. And on the right column, it's the time codes, okay? So that's basically what I've just described for you. Now, notice, maybe I'll just go back one. There is no code here that's fitting for WCB and ICBC. For that, you have to flip to your old fee-for-service codes and bill it that way. So just keep that in mind. For a detailed reference on billing, you can go to the BC Family Doctors website, and it'll kind of tell you. It's a really well laid out site. So here's my shameless plug to join the Family Doctors of BC if you haven't already joined. So to create a new billing form, it's an administrative duty. So you need to go to admin. I'm going to run through this fairly quickly, and then I'm going to do it as a demo. You need admin privileges, obviously. You would go into the manage billing form area and just create a billing page. You can see all your billing pages here, and then I'll show you in a moment where the easy parts are and where the dangerous parts are. And again, this is for reference. I'm going to change my page. I'm going to stop the PowerPoint just for a moment and then move on. Now, I hope you can see this. This is my pretend day sheet for the weekend. I put in LFP time for a reason. I'll show you in a second. Can everyone see that? I hope that worked. Joelle? Okay, perfect. Yeah, thank you. So if you are on a well system, you'll see this looks quite familiar. Here's the administration area. I zoomed in so it's big enough, so hopefully you can see. You go into billing. You're going to manage your billing form. And then you can choose whether it's diagnostic codes, which is somewhat useful, but most useful is your service code. You have to check this first. And for whatever reason, the default is general practice. And that would be the old fee-for-service general practice codes. Just to have a quick peek, I'll go to that, and you'll see a bunch of numbers. Left column, these are your office visits. Right column, these are your others. And then the middle column are complex care and various other things, okay? Let me just go back, if I can. Oh yeah, back to this. If you want to create a new form, this is where you do it. You add a new form. If you do so, you have to click service code first, start from here, go from left to right. You will get this. Now, this is where the danger can arise. All these abbreviations here, these 2- and 3-letter codes, are specific IDs for your forms that already exist. And obviously, whoever made them created, somewhat relevant abbreviations. AN for anesthesia. Here you see LTC for long-term care, and so on and so forth. It goes all the way down. The reason there are so many entries is every time you create a change, it likely keeps an audit trail for you. What I learned by mistake is if you delete one of them, you delete all of them. So That's one of the dangers. Caution, stay away from this hyperlink. To create a new form, you have to create a unique ID, 2, 3, potentially 4 letters. It looks like I can get away with 3. Create a 3-letter ID code that's distinct from anything that already exists. Give it a relevant name. This can be OB obstetrics, which sounds a bit redundant, but I see there's anesthesia with a typo. I'm not even going to try and correct it because it'll probably ruin it. And I don't go there anyways, but give it some thought, make it relevant, such as, well, I was on contract at one time, so we had contract family physician. Here's all the private stuff. That was the original general practice. I created a test one. There's my LFP locum, if you're fortunate to get locums, and nowadays it's actually not so bad. These are the column names. You can customize them to, office or procedures and time codes. So once you've got a unique ID and a proper name, you can add the form and it will appear, but it will be blank. You need to populate it. Okay. So I'm going to get away from this for now and go back way down here. And just briefly go back to my PowerPoint here. So I jumped ahead. We did all of this stuff already. And please speak up, put your hand up if I've lost you at any point, okay? These are all the helpful hints and tricks and things to be aware of. There's the names again. Beware, 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 okay? These are hyperlinked. You can delete them, but you'll never get it back. Here's a hint. You can use my PowerPoint as a reference to how you might want your code to look like. Or you can create one on a spreadsheet and just put in the codes in the order that you prefer. And you can actually change the order if you wish after the fact, and I'll show you how. So when I created the LFP code originally, this is what I used: LFP care codes, procedures, and time codes. I click add, and then it appeared. In the actual billing page, if it's selected, that's what you would see initially, basically nothing. And the reason there's nothing there is I didn't put any codes yet. You actually have to add the codes. And this is what you will see initially when you go to that page. And if you're actually doing this along the way, you'll know what I mean. I did name the care codes, the procedure codes, and the time codes in the columns. This is where you start adding your codes, and you have to know what they are. So use the BC Family Doctors reference. So this could be your office visit code, like that. Or this could be your, what's the next, a virtual code, a group visit code, or some other code. So again, use your reference. Now, in the next column to the right of your actual fee code are these numbers, which basically position the codes from top to bottom. Number 1 is at the top, number 4 at the bottom here. You can see if you wanted to force a code number to go to the very bottom, you give it a high number. And if you were keeping track, there's 20 rows you can use. So we can add 20 codes, which is the limit if you have a lot of unique codes. For example, the nurses in practice, they have hundreds of codes. Fortunately, we only have a handful here. Okay. So once you put the codes in, they have to exist. If they don't exist in your system, putting them in will get you nowhere. Generally, they are numerical. If you have 2 codes with the number 1, it will sort in the number based on the left column, basically. Okay. But in general, you can add, for example, if you wanted 9800 code, 98000, and you wanted to be at the top, you give it a number 1 and it would be above this 31 code. Okay, so I hope that's pretty simple to understand. Once those numbers are in, this is what you see. This is what you want to see. Okay, and these are the descriptions that are provided by MSP, and some of them are good. Like this is an in-person clinic visit.
But this is an interaction with advanced procedure. What's an advanced procedure? You can use your handy dandy reference from the Family Practice BC, or you can use Grease Monkey. Okay, so how would Grease Monkey look? Let's leave this for a moment and go to, I thought I put in a patient here. I'll put in a patient, my test patient. Set the spelling right. So this is for a billing form webinar. Perfect. Okay, so I've set my preference to always LFP. It always chooses my name. It always chooses LFP. And here are the codes that I added. And I added a recent one since the PowerPoint. I added LFP consultation. It turns out that one of my partners does consults for IMS work. Here are the procedure codes. And what's an advanced procedure? Well, this is where Grease Monkey comes in. An advanced procedure could be inserting IUD, or doing a joint injection, or doing a skin excision. Now, you may not be able to see this. There's a little pop-up that describes 9302 is a biopsy, excision, suturing, foreign body removal. IND's in there twice. It does not allow you to bill a visit code if you bill this procedure. It's that and nothing else. Same with if you do a PAP, no visit code is allowed. So if I was doing a PAP today, for example, I just click that and it pre-populates with the diagnostic code. That's what Grease Monkey can do. You can do some of this within OSCAR with the basics, but you will not get the reminder that one of these is a PAP smear. And that's because of recycled codes, which is a blessing because it's fewer codes, but it's a curse unless you know which codes they are. Here are the time codes. When I click, I'm going to bill for my direct time. This lights up my start and end time. I know I have to fill this in. It's not built into OSCAR that you must apply a time code. It can be, but the powers that be haven't really put that in, and that's not within your control or my control. So it has to be from the programmers. There are certain codes from back in the fee-for-service dates, like counseling codes, where you have to put in a time, or those complex care fee codes. I think that required a time, but not here. And this is those diagnostic codes. Remember, there was the fee codes and diagnostic codes. If you wanted to add extra diagnostic codes to remind you, that's where they end up. So some people find that helpful. I actually do, because there's certain codes I always look up. And if you agonize over it and you're always looking up, you might as well park it there for easy reference. That's where it resides. These are codes that have been billed previously, so they always show up on anyone you bill for. So this is basically how the LFP fee code should look. If I was billing WCB, I would have to switch this from LFP to general practice, and then switch this to, well, WCB and go from there. This is not the best example because you're probably billing through the billing form or WCB form. Maybe a better example is if you're billing ICBC, and then you would use these fee codes if necessary, or more likely billing as CL489, which in this case is actually a private code. So the CL489 stuff is all here. So it isn't difficult to create that billing page. It's highly desirable to do so, so you're not always flipping back and forth. If you have some way of reminding yourself easily what all the procedure codes mean, great. But I can't remember all of that, and I basically use Grease Monkey all the time, and I bill using this code. These things here just disappeared for a second. Let me refresh. It's on private. There we go. I bill here instead of clicking here. It's just that much easier. I did build something recently that I hadn't built before. It's kind of sad because it was a made fee code. So in order to add that into my billing code, billing page rather, I'm just going to do it now for you. Manage billing fee, it's a service code. And for the time being, I'm going to put it in LFP and I'll add it here. It was a 15301. I hope that's it. It's number 7. Let's see if this works. Didn't like it. Oh, sorry. Didn't do it right. 15301. 7. I have to update. Update is down here. So if this indeed worked, sorry, I forgot the code. It's not 15301. This is indeed one of the old fee codes for billing a complete physical for somebody aged 50 to 59. But it's as easy as that. And if you wanted this number to be at the top, instead of making it a 7, you would make it a 1. So you can adjust the order if you wish. Missed it by 1. It is in the second position. I guess that one squatted on it. I'll remove that later so my partners don't get confused. Okay, so I'm just going to switch back here to my PowerPoint. So are there any questions so far, Joelle?
No, we don't
No.
appear to have any questions.
Okay. Either I've lost you or this is all too simple. This is additional to the billing page. This is how you may want to set up your different accounts. I hope that you all have access to this edit billing preferences. It certainly is available in Oscar from Well. I hope it's available in Open and all the others and Juno, but I can't make any promises. I'm not as familiar with those. So the set billing form preference leads you to this page. This is the page where I can set for myself, LFP is my go-to default form, and the default billing provider is me. The location of this is this. The default payee is for third-party billings actually, so that it shows up like this in your invoices. We set diagnostic codes with 3 options because I can put as many ICD-9 codes as possible. That helps calculate complexity. Our clinic default is to set it at 3. I don't claim GST, so I leave that blank. So why is this important? If you have a locum, you would change this to your LFP locum form once you create it, of course. When you bill from, say, a lab, going to the chart, then going to billing, it may not select you as the default provider. It's usually set to null or nil, and you have to select it yourself each and every time. So it's a bit of a pain in the butt. By setting it here, it's always going to be you. I have residents that I teach, and the higher level residents do billing on my behalf. So they set it to me and to bill on my behalf. Unless they're working with somebody else, then they switch it to the other preceptor. So that's the point of this page. So change it for locums, for your residents, for your nurses or allied professionals who work with you. The default pays indeed for your private billings. Here's an example of me setting it for myself. And so this is also related, but totally different. And that is your provider list tends to have a lot of names. Every locum that you've ever had likely is still in there unless you deactivate them and do some other shenanigans. One thing you don't want to do, and this goes across the board, so please listen, do not delete an account. even if you know that physician, that nurse, that MOA will never ever set foot in your office again. They may have retired, expired, whatever. Do not delete an account. The reason being, any work that they do on their account is saved with their name. And that name's attached to the account. If you delete it, the name disappears. And that's not a good thing. So please don't do that. You can't retrieve it. It's one of those do not do things. Okay. However, if you don't want a account to appear on your billing page, you have to demote that doctor to a receptionist or some other status. That will take them off that list. So you may want to do that for locums that no longer are locums. Maybe they are, they've got their own practice going and such. Okay. This is where you can set. This is an example from within Well Health. The default diagnostic code settings to 3 options. I think originally it was just 1, but it makes sense to put as much detail into your diagnostic codes as possible. In an LFP and a NutriPractice payment schema, your patient roster, your population will be judged based on complexity, and there are bonuses for the higher complexity practices. So make sure you put in the relevant diagnostic codes, and you have to click save. All right. You can indeed link up diagnostic codes with service codes. We used to do this all the time in fee-for-service, where, as you can see here, a 14560 pap smear is linked with diagnostic code V762, which for a decade or so, I used the wrong code. Apparently this is the right code. Well, now you can substitute 14560 for whatever the LFP code is. Okay, it's probably down here somewhere. So you can do that. It is, just quickly, I'll show you where. It's under billing and under managed service and diagnostic code associations. So there's that original one, the very first one, the pap smear one, but all the newer ones are down here. And you can see 98010 is an L23. That's your time codes for LFP. And this is probably your indirect time. This is probably admin time. So you can add all those unique codes that have to have that diagnostic code at this point. Okay, so that's pretty straightforward, and anyone should be able to do that. It does not require Grease Monkey. Make sure to save it once you're done. And indeed, this is Grease Monkey. I've already demoed it. Grease Monkey is just something I cannot live without. It requires some expertise. It requires some customization. Mine works in Well. It may not work in Open. It may not work in Juno, Ampere, and other versions of Oscar. In which case, you'll need to tap somebody with programming chops to help you figure that out, if it's that important to you. Oh, yeah, this is the PowerPoint I recycled from the summer at OscarCon. This is without Grease Monkey, and you can see it's really bare, and I'm kind of lost without my Grease Monkey hints. And that's pretty much it for the PowerPoint and my presentation and demos. I'm more than happy to field questions based on this or anything else for that matter, because I think we have the time. So let me just stop screen share for the time being. Here we go.
We do have time. That was, you ran right through that. And apparently you're so good, John, that nobody has any questions today, but please unmute yourself and chime in if you do have questions. Okay, we have one from Norma. Is there a way to edit the payee name in my preferences?
In your preferences, absolutely. Let me cue this up first. I'll get to my screen in just a second. So where's preferences? Oh, why don't I do it now? So here's my schedule page, and here's preferences. Then there's the billing preferences here. The problem is these are based on how you make your account. So if you change the name in your account, that's not deleting it. Your account is tied to your provider number. That's the critical thing. My provider number is, for example, 100. If I change it to, Joe Smith, my name, then all my signed notes will now say Joe Smith. So it's not something you want to do. And if I deleted it complete, that's even a bigger disaster. So the names will be whatever is here on the list. These are all the providers, some of whom no longer work with us. So it obviously needs some housekeeping. So yes and no. You can't customize it here. Like if I change this to, it changes here. It's kind of set. So I'm not going to save this, so it won't change anything for me. So it's not an ideal solution. It'd be nice if you can completely customize it, but you can't for this purpose. For your signature, though.
She has an addition to that. We have to use a different name than our actual clinic name. And I'm not sure if you want to unmute and explain anything there, Norma?
Yeah, go ahead.
Oh, hi.
I'm just going to kill my presentation there.
Oh,
Yeah,
hi.
go ahead.
Yeah, can you hear me? So
Yes.
because we are only a part of a larger organization, and if checks have to come, so if we're doing a private building, then we have to tell them to make the check out to PHS Community Services rather than PHS Healthcare, which is our medical branch. Otherwise, they can't deposit the check.
That's a bit of a sticky wicket there. Let me see what you might be able to do in a private billing. Because there's so many settings here that like there's no rhyme or reason to it. It's not alphabetical. It's not organized into groups. It's really quite
Terrible.
dog's breakfast. Let's see, find billing. Edit diagnostic code, edit billing preferences. Oh, there's only those two. I would say I've never had to do that the way you describe. I think you'd have to create an account almost and bill it on that account. And that's reasonable. You can build as many accounts as you want, but depending on who your provider is, for private billings, right? You're referencing private billings?
Yes, that's right.
Why don't you create a dummy account for private billings? The reason I kind of hesitated for is in order to send to Teleplan, you need a billing number and all the other things. And some of the OSPs will basically charge you for being an extra, a user.
Yes, they will.
But you can create as many non-billing, non-MSP billing
Okay.
as you want. And you can, create it that way, do it that way.
Okay, that's an interesting, thank you.
Yeah. So you know how to create an account, right?
Yeah, that's great.
Put in all the particulars, the exact wording that you wish, and go from here.
Okay, that's a great idea. Thank you.
It'd be very clever and
yeah, I know. I've tried lots of different things,
solutions.
Yeah, thank you.
All right. Any other questions? I think for most users, creating a locum one and LFP one would be ideal. I'm also working with PSB a fair bit with new to practice physicians. So they would have a new to practice set of codes, which is a somewhat, quite different really. One of our physicians recently transitioned from NTP to LFP. So he was contract here, and he's billing these unusual codes. And again, having Grease Monkey helped, and he was a very clever guy programming Grease Monkey, so he made it easier for himself.
Okay, I have another question here for you. How to bill only for injection at $10 gets rejected.
Oh, it will be if you only bill for injections. So you have to describe what are the circumstances that you were able to inject that patient without seeing them in their office. That's the point. So, Chitra, you have to bill an office visit if you give an injection. If you don't see them in the office, how possibly, just like a lab, you cannot just have the patient drop off a urine sample so you can dip it and bill for it. Okay. So the BC Family Doctor's Guide to LFP billing specifically states there are certain codes that must accompany other codes. An injection code must accompany a visit code. So you get $25 plus the $10. But if you only bill the injection code without the visit code, it will be rejected. Now, if you're having a nurse do it, that's a different story. Nurses can bill certain things, but under LFP, it's different. Our nurses can give injections. They bill for it as a shadow billing. They're paid by the health authority. It's a very unique situation we have. We as physicians, even though they use our supply, our space and everything, cannot bill for that. If we see the patient for something else and provide medical services in that regard, yes, we bill for that visit, but not for that injection. So basically, our nurse does most of our vaccines nowadays, and our B12 shots, testosterone shots, etc. So if she does it, I don't bill for it. If I have to see them, refill the prescriptions or anything, I bill for it. Does that make sense? Oh, and Norma says there is a code for a nurse to bill an injection, but beware, the nurse can bill on the clinic's behalf for the clinic if you are paying that nurse. In our clinic, we don't pay the nurse, the health authority does. So we cannot recoup those costs because it's not really costing us.
So the question that Norma is for clarification, how do you do shadow billing? Our nurses
How do
are
you do
paid by the
shadow
health
billing?
authority.
Oh, well, am I still screen sharing here? I'll show you our nurses code. So they basically will see the patient, nurse in practice visit in office, age appropriate, and there's a ton of them. Basically, they bill it and send it to Teleplan. And they're doing it to track their activities. And you see they're all $0 codes. They're not getting paid through Teleplan. But the auditors, the people who monitor this particular program, are tracking to see if they're actually doing things. And this is how they track it. Well, new to practice physicians bill this way too. They're billing the hours and not, the services. So all my codes when I was on group practice rather were $0 values. It was kind of depressing seeing that, but then the hourly rates were not so bad.
So yeah, there's a comment, tried billing $0 for visit and then billed for injection, it was paid. So
Yeah, but why
$0.
bother? If you're a physician and you're seeing the patient and giving them a B12 shot, flu shot, or whatever, I mean, $10 for a flu shot is way better than what we were getting previously, which was basically nothing for the most part. Any other questions? Yes, Danielle.
Yeah.
Hello again.
Dr. Yep, nice to see you again. I have a question not related to billing. Some doctors complain the standardized flow sheet is too long. Rather than creating a new flow sheet, do you have any suggestion to customize those flow sheet or make it shorter?
So Oscar, when it was built for team-based care in Ontario. And I guess, 20 years ago, it served its purposes, a lot of different providers there. And the flow sheet you're likely referring to, if I can use my test Andy again, are the chronic disease management flow
Yeah,
sheets. In this case, they are under measurements. For example, there's an asthma flow sheet. I've never
yeah.
actually used it because they never liked any of their flow sheets. Somebody created various measurements like asthma limits physical activity and decided that, you can put a comment by clicking on this and adding a comment. But yes or no or not applicable, it's very vague, you know. So for that reason alone, I never liked it. Somewhere along the line, somebody thought it'd be very nice to be able to customize it. So they came out with this new thing that is in every chart, CDM indicators, chronic
Okay.
disease management indicators, which is actually quite misleading. And sorry, this is not a billing page talk anymore. This is a critique of somebody who had a great idea but didn't complete it. So any physician out there will recognize that these are all diabetes indicators, A1C, insulin, blah, 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 and so on and so forth, ACE inhibitors and such. And this basically is a new way of presenting the old diabetes flow sheet, which looks like
Yeah,
this, which
very,
is
very.
ugly as sin, and there's no rhyme or reason or order other than red means it's like out of date, which it hasn't been checked in 85 months. Okay, so can you customize this? The intention was yes. The actual execution is no. And would you like to make your own? I've heard people try, and I never hear from them again.
Okay. Yeah, we try to make a customized flow sheet, but I just wonder, is there a
So I
way?
wouldn't. I really wouldn't. I'll tell you what we did instead, because Oscar users are very, very clever. This is back in the day when we had complex care plan. Oops. There's a full and a light, and this came from Chilliwack. I'll give credit for credit is due. The group in Chilliwack created this very complicated and very useful form back in the day. If you chose asthma as your condition, it populated with treatment
Okay.
targets and goals. And somebody put some thought into it in terms of orders and whatnot, give it some free space you can type things in, and you would go back to this. You wouldn't do this all in one go around. You'd chip away at it. You do a little bit here, a little bit there. The problem is, and this is the downfall of doing complex care when there's more than one condition, is some of these conditions overlap and basically conflict. And to try and meet all these goals makes it near impossible.
Yeah.
So flow sheets are great if you have one condition and only one condition, and you're good at just reading questions and putting in yes, no answers. I think as physicians, we have to give it a bit more thought and prioritize based on what the patient's needs are and what they wish to address. To create a simpler version, and you see we needed time-based things here. This would pre-populate with things, and we would again go through the care plan. And this became a more patient-centric option. They wanted to, lose some weight. Well, how much weight, and so on and so forth. And then we can have those discussions. And so this could be pasted into the chart once you type in the information, and then it would be part of your progress notes. But now with basic LFP, there's no need to document it this way. You still need to document, don't get me wrong, put in the progress notes.
Yes. Thank you.
Yeah. And there's one other thing that was asked, actually, it wasn't that long ago. It was the diabetes. Let me see if I can find it. Diabetes tool. Let's see if this is it. No. So if you didn't know already, I create a lot of eForm content. And there's so many with similar names that I actually get lost in the shuffle. So it's not here. Diabetes advisor. Advisors are always helpful. This came from the Canadian Diabetes website and at the physician level, where you can add, and this is specific for diabetes. You can do this. You can create your own, I suppose, for heart failure and whatever you wish if there's guidelines available. And where it would populate, and you would basically pick a day and start, putting in the things that you felt were helpful, and just work your way down. All the references are on the sideline and so forth. If cardiovascular risk tools, it probably goes to, wait for it. Oh boy, this is slow. Oh, it goes to a website. That's why, the guidelines. Oh my goodness, it may be a dead link. Try something else. This one. Okay. I personally don't use this because I pick and choose only a select a set of items. If I'm doing a QI project, I'll focus on that. For example, SADMAN rules here. It's actually addressed here for sick day guidelines. And there's this really nice e-form for SADMAN rules. We're getting a little off topic here. It's no longer
Yeah.
but I think if you want to do complex care well, you have to have a game plan in mind. These are good references, but do you want to fill in fields for the sake of filling in fields, or do you want to deal with what the patient feels is important, match with what you feel is important? Hopefully you'll come to some mutual agreement as to what direction to head in, because you couldn't possibly check every box in that complex
Yeah.
care list. It's just too many boxes. Any other questions?
Thank you, Dr. Yep.
You're welcome.
Thank you, Danielle. No, that seems like it's it for questions tonight. So
All right. So I want to thank you all for joining me and listening yet again to my talk. I hope that was helpful. If you have any suggestions for other topics, please, send a note to OscarBC, and Danielle already knows this. I love teaching. I teach medical students. I teach residents. I teach other physicians. It's just what I do. I teach patients, actually. That's what we all do as physicians.
Okay, thank you everybody for joining us. Have a great night and take care.
Take care. Bye, everyone.
Okay, bye-bye.